Campbell. I work for Blue Cross Blue Shield of Illinois. It's part of the Healthcare Service Corporation umbrella of Blues plans. We have Blue Cross Blue Shield of Texas, New Mexico, Oklahoma, Montana, and Illinois. I work out of the Chicago office. I'm an IT product manager there. I oversee the 270, 276, 275, a couple other proprietary things, and a whole bunch of conversations. I like to talk a lot, can you tell? So without further ado, I'm going to introduce DocStudio with Alyssa and Eugen, who are here. Alyssa's the VP of Business Development, and Eugen is the Chief Technical Officer, and they're going to hit you up with some information about DocStudio. Take it away.
Thank you, Donna. Oh, wow, it's loud. Hello, everyone. We know it's going to be late in the last session before the reception and before some cocktails. So we gotta be maybe 30 minutes long or something like this, to not trying to keeping you for long with us.
Houston, we have a problem. It's not changing.
Here we are.
Slides. Oh, now it's worked. Thank you.
Okay, so my name is Alyssa. Here is my colleague Eugene, and today we will be delivering the presentation Beyond Paperwork, Streamlining Healthcare Documents with DocStudio, Navigating Regulatory and Non-Regulatory Documents. Today, pretty much like here to uncover how DocStudio comes into play when we are talking about the document processes and contract lifecycle management in the healthcare.
All right. So over the past 16 years, our company has deeply involved in different EDI, e-documents, master data catalog management initiatives. And those initiatives were related to retail, healthcare, oil and gas, financial industries. With our international team, we've created and implemented EDI and document management solutions for different industries and regions. DocStudio goes beyond traditional EDI processes, aiming to digitize all document-related processes within organizations.
And our discussion today would actually reveal around 3 key areas. So the very first aspect is regulatory documents or HIPAA EDI transactions. And we believe this topic has been covered today and in general, maybe dozens of times, even more. But we actually just understand their importance, and we will slightly try to uncover how DocStudio comes into play when we're talking about this type of the documents. Afterwards, we'll a little bit cover the healthcare data exchange and such standard like HL7 and USCDI, perhaps not as widely discussed, but equally vital. And the last key aspect that we'll be covering today the most is non-regulatory documents or contract lifecycle management. While they might not steal the spotlight of the today conversations, like we personally think they're essential components of healthcare collaboration. We can actually think about service level contracts, vendor agreements, NDAs, and so on.
Yes, so as we venture further into the world of healthcare document management, we encounter some significant challenges, and specifically in the realm of document and data exchange. So firstly, it's the really diverse document portfolio in our exploration of healthcare document management. We're confronted with significant challenges. The industry deals with really diverse portfolio, as I said before. And it's not only the contracts and non-disclosure agreements, it's the application, different HR documents as well. But it's not just about the collecting these documents, it's about managing them effectively to ensure the operational efficiency. Furthermore, I think about the exchange of these documents with various counterparties and the need for e-signatures, secure storage, etc. It's like juggling multiple balls in the air, and each of the balls presents the critical part of the healthcare operations. This task is true task of organizational and efficiency in the organization. Secondly, it's the data sharing complexity, right? So healthcare made strides in adopting data sharing standards like FHIR and USCDI. And the goal is to improve data sharing across healthcare systems, but achieving seamless data exchange remains the persistent challenge. Thirdly, it's the balancing collaboration and the organization of those documents. So on the one hand, we have collaboration, and it's a core element of healthcare, fostering the innovation and teamwork. But on the other hand, it comes with the price. Next, it comes with the interoperability across the systems and applications. Healthcare systems are diverse. They often struggle to communicate and share data seamlessly. Ensuring interoperability and data consistency is no small feat for healthcare organizations. It's like connect different languages and then make them understand each other. These challenges are not unique for that particular industry. We've seen that before, but they are essential to address for the sake of efficiency, patient care, and overall effectiveness in the organization. As we explore these issues further, let's remember that they are opportunities to improve at the first place, to innovate and advance in the healthcare document management landscape.
And now let's dive into the very first key area, regulatory documents or HIPAA transactions. This topic is well explored and covered in general, but we particularly want to focus on how DocStudio covers this topic and comes into play. For payers, we aim to elevate electronic collaboration with providers. Think of it as improving the conversation between payers and healthcare providers, making it quicker, automated, and efficient. For providers, it's all about engaging electronically with payers. This means expediting, responding, and automating the processes for a smoother, faster cooperation. And it doesn't stop there. DocStudio also helps you to generate HIPAA-compliant documents like claims, eligibility inquiries, payments, records, ensuring they adhere to the required standards, but also meet unique requirements for each company, particular data sets and standards and formats. We also want to make sure that everyone has a possibility to exchange those core documents, whether it's a provider and payer with the complex integrations or small, providing access to the web EDI. DocStudio in this case acts as a translator in the story, as it converts and structures healthcare data into the multiple format and standards, making sure that we're adhering to the each particular format and the standard of each company, whether it's a big company that having a complex integrations and advanced IT team, or there is a small provider or payer that only operates within their web user interface, and we are using their laptop to exchange claims and other documents. We also want to make sure that we will validate all of the documents that it meets HIPAA regulations, identifying and fixing errors before transmission, preventing compliance violations. If very shortly, we want to help to address the complex world of regulatory documents and HIPAA transactions. Again, even make sure that this functionality and these services, they're available for everyone. Doesn't matter of the size of the integration or the complexities of the system you have within the healthcare sector. Thank you. In this slide, you will see messages commonly used throughout the industry. Next slide, please. And when we refer to these messages, we recognize them as text messages that look like this. But actually, within DocStudio, we view each message like this. So pretty much, this is a template library that contains business messages, documents like claims, payments, attachments, prioritizations, etc. And every business message in our system is associated with a document template or visual form that mirrors, in this case, the X12 message or any other document type. templates in this case serve as the cornerstone of the DocStudio platform, enabling us to design and implement various document templates seamlessly, but also make sure that we adhere to the standards data sets, but also we're able to be flexible. So it's the additional fields and data sets that are particularly meet some specific needs of each company. What's fascinating might still look like a PDF on the surface is backed by an XML structure that can be effortlessly converted into multiple formats like X12, JSON, UBL, ISO, and so on. So pretty much this approach empowers everyone, whether you have a complex integration and supports, or you want to exchange structured data, but you don't have the IT possibilities and you only need to use EDI interface. In the upcoming slides, we will just take a closer. So in the couple of next slides, we will just present some of the business messages or the visual representation that has been implemented on DocStudio. And they could be either exchanged one by one, or they could be also interconnected within the interconnected scenario, or we also like to call them chains. So it pretty much means that one message triggers in another, such as 271 initiated by the data from 270 and so on. Another slide, please. Okay. All right. So I think one slide just wasn't loaded. But anyway, so one more thing to mention that as we are working with the structured data behind each document, it's important that within the platform, we also have inbuilt mapping tool. So with this, we are also able to transform and convert the documents from multiple formats to another. Like in this case, if DocStudio has an XML structure, we can transform it to the X12. But if we are working within the multiple regions or it's cross-Atlantic document exchange, we are able to transform it to the particular standards of each region or each industry. So for example, if there is a need to exchange the documents between the healthcare industry or let's say like gas and oil industry or something like this, they both adhere within the different formats. So within mapping tool, we are able to seamlessly transform and convert the data. So the next thing is pretty much, we'll talk about the dictionary, DocStudio. In this case, dictionary acts as a dynamic database or live record lists, seamlessly integrated into business messages. So these records could be either managed directly on the platform or integrated with already existing systems within the company. So for example, this dictionary includes the range of critical data, including X12 external code lists, employee or patient records. Also, that could include the important code size like current dental terminology or national drug codes, etc.
Thank you, Alyssa. Now let's shift our focus to the second vital element of healthcare document and data exchange with DocStudio, healthcare data exchange framework. And we're going to talk about HL7 FHIR and US CDI standards. So FHIR and US CDI are essential standards in healthcare data. FHIR ensures data is appropriately exchanged, and US CDI, on the other hand, defines a core set of healthcare elements that must be accessible for better data exchange and interoperability among healthcare systems. These standards play a crucial role in improving healthcare data sharing and research while keeping patient privacy in mind. So why does healthcare need those standards? Imagine a scenario where healthcare providers, especially some specialists, need to access various electronic systems and view the patient's relevant diagnosis. It becomes even more complex when they work in outpatient clinics without connection to the local hospital system. That's where FHIR and USCDI standards step in. They establish a common language for clinical data categories like diagnosis, allergies, and procedures. This ensures that data can be shared among EHRs without any confusion or the risk of misinterpretation. By embracing these standards, healthcare organizations can ensure that their data is consistently structured and seamlessly shared within the system and applications. These standards are providing remarkable advantages, I believe we all know of, but still, some of them are consistent data structure and seamless data exchange, enhanced care coordination, structured and effortlessly shared data empowers healthcare organization to deliver seamlessly coordinated care, synchronizing medical records, treatments, and patient care. And the important part is the data security and scalability. The data security is paramount. And in DocStudio, we include robust security features to safeguard patient health information during transmission and storage. This ensures that healthcare organizations meet data privacy regulation. And last but not least, it's the application communications. They facilitate the seamless exchange of data between different systems, ensuring healthcare information flows efficiently across various platforms and different applications. On this slide, we'll take a closer look on HL7 message consultation node. This data set ensures a consistent and organized approach for exchanging healthcare information. So on the next slide, we see the same data set, but within the DocStudio. We'll explore the particular sample demonstrating the implementing of the consultation node data set within DocStudio, complete with the essential data properties to ensure the seamless transfer of necessary information through the REST APIs and the WEDI technologies. As Alyssa said before, all the documents going through the DocStudio can be seen through the WEDI platform and downloaded or exchanged as the XML or converted to JSON. At the transition to the final segment of our presentation, which focuses on the contract lifecycle management and non-regulatory documents, we'll take some time to delve into details on significance of these often overlooked aspects. We honestly believe that these processes are indeed underrated and definitely deserve more attention and comprehensive understanding. So what is precisely the CLM or contract lifecycle management in the context of healthcare? We are dealing with contracts and agreements in our day-to-day work. It could be anything from a simple handshake deal to a formal document that needs signatures, like the applications. Now think about all the paperwork, emails, and back and forth goes into it. That's what we call contract management. It's basically how we handle these agreements, whether they're on paper, the PDF, emails, or even handwritten. These traditional methods can be a real hassle, and you get document flying around, a lot of manual work, and the risk of errors. And as previous speaker said, the manual work means that people do work by hands, and that is the prone to errors and delays. But here's the good news. The CLM, or the lifecycle management, is like an upgrade. It takes those messy processes and makes them digital and organized. You can create, negotiate, and keep track of contracts with ease. No more drowning in paperwork or lose track of important documents. It's all about streamlining processes, saving time, and making life a lot easier. Healthcare organizations facing numerous challenges in contract management, including the need to handle a large volume of contracts, ensuring compliance with complex regulatory requirements, manage sensitive patient data. They also face the struggle of streamlining manual processes, like all the companies, basically, maintaining version control and facilitating efficient contract negotiations, all while maintaining a high standard of accuracy and avoiding errors in the critical domain.
Now, as we learn slightly more about the contract lifecycle management or non-regulatory documents, we slightly want to uncover some of the solutions and practical aspects on how we can deal with those challenges and proceed with the smooth contract lifecycle management. But first, I just want to provide a couple of examples. What are the samples of the contracts within the healthcare organization? So these documents is pretty much include those shared between the providers and patients, like patient educational materials and referral letters. There are also some documents exchanged between doctors and providers, such as physician employment contract and consultation requests. Additionally, you have agreements between payers or providers with their vendors. It could be like vendor agreements or leasing or purchase documents and different contracts for the cooperation. And of course, you'll find some of the change between providers and payers, like provider enrollment application, provider agreements, contract negotiation document, and of course, it's going to be non-disclosure agreements and some HIPAA business associate agreements between covered entities and business associates. In the couple of the upcoming slides, we will just have a look on some of the functions that are in the heart of the contract lifecycle management. So as mentioned for a couple of times already, DocStudio has an inbuilt templates editor or templates constructor. So that pretty much enables you to create any existing document template that your company operates within the daily basis. Either it's going to be a regulatory document or a contract agreements, NDA, some of the documents exchanged inside the company within human resources or operational departments. Those documents could also, just one slide back, thank you. These documents could also include some of the static information and some of the dynamic fields that would be actually assigned to the participants within the workflow and would be filled inside. And as I've mentioned regarding the workflow, every document follows a specific workflow that outlines which stages it must pass in regards to be completed. So it could be either approval, either we need someone to fill the document or sign the document. Those processes could happen simultaneously or in the particular ordered predefined within the workflow. And of course, in line with the GDPR compliance or other data security and privacy standards, every completed document in the end of this process receives a digital stamp or a digital passport, we love to call it, which includes an audit trail, a document process and signing certificates, and also we record all of the logs that have been ever completed with the document. So we pretty much are able to track what data has been processed, who has opened, signed, viewed the documents, who has been involved within the workflow, and so on. And just a quick, just another thing, that even the contracts in our case, we are working still with the structured data, so we are able to make the data live and be able to transfer the data to other company systems. So whenever, like still some company, they're working with the paper-based documents, or it's going to be PDF sent via email or different portals. In this case, we're using the PDF or like scanned documents or something like this. It means that this data could not be stored, analyzed, or transferred to any other systems. In our case, with all the time, we'll have this structure behind each document. So it means we'll be able to transfer the data to the human resource platforms, to the warehouse management platform systems, ERP systems, and so on.
Yeah, now to illustrate the document exchange process, we'll present a brief video demonstration. This video, they'll walk you through a simple document exchange using a simple HIPAA business associate agreement for collaborative services. We'll start with creating the documents, configuring the workflows, and then we'll see how it's going to be seen and signed by the counterparties.
Welcome to a simpler way of managing healthcare contracts, agreements, and non-regulatory documents. In this video, we briefly uncover the secure and efficient way to healthcare contract lifecycle management in a few simple steps with DocStudio. Start by creating your document template with our user-friendly template constructor. This tool enables you to include static elements like text, images, tables, etc. Additionally, you can incorporate various dynamic fields tailored to specific roles and establish a customized document flow for each role. Initiate a document from a pre-designed template located within your template library. Specify the participants involved in the processing flow, each with distinct roles such as assignee, signer, approver, and more. Complete the fields that have been assigned to you. Sign the document if necessary, and then send the document to your counterparties. This part represents the recipient's viewpoint, whether they are in the role of an approver, deciding whether to approve or reject it, or the assignee role with the email address. Unregistered user receives an email that leads to a platform where they can sign the document and fill in the assigned fields to complete it. All documents are securely stored within the account mailboxes of every participant. Each party has access to the document audit log that tracks any interactions, ensuring transparency. Document archive. Within the archive, documents will be stored in human-readable PDF format, machine-readable XML format, as well as with their signing certificates to ensure their integrity. To guarantee the unalterable nature of each document, there's also the option to securely store the hash of completed document on the blockchain. Once the hash of the completed document is published and securely stored in the blockchain, a blockchain certificate would be generated. This adds an extra layer of assurance, utilizing the power of blockchain technology to safeguard the integrity and legitimacy of the document. As we conclude this journey through contract lifecycle management in healthcare, it's evident that the days of manual contract tracking and missed opportunities are behind us. With DocStudio, contracts are no longer static documents, but dynamic assets that drive efficiency and success.
Okay. And now we are available for the questions, if you might have one. If not, or later, you can locate us close to the food, let's say so. Yeah. Thank you so much, and we appreciate your attention and participation.
I have a question. Of course. So I know a lot of that was in English. Is there a translator tool to convert it to a different language if you want those documents in a different language, like Spanish or German?
So we actually do not have like an inbuilt language translator, but I think if the question, is it possible? Yes, it is possible.
I need to trademark that idea so you don't steal it. I'm walking over to Ed. I know, but in the document and save it.
Yeah, first of all, if you notice Donna, she's very fast. She leads the walking between our hotel. And so if you want to join the walking club, talk to Donna. Yeah. I do have a couple questions. One was very interesting. I think it was mentioned about different industries. And so I always think of enrollment. So like if you're in Texas and you're HCSC and you want to talk to a bunch of petroleum companies and leverage their systems, and they may do XML in the PDEX format in an enrollment transaction, taking that XML stream in versus having a web form. Can you take that in that way and then translate it to EDI?
Yeah, basically that was one of the slides which are not loaded, but what we can do is we can ingest the documents in the various formats. What we require is that they gonna be structured documents, right? So we can kind of convert that to something within the system, and within the system we basically store everything in XML. So if that is XML convertible, we can ingest that, or we can take API calls, right?
Okay.
And then afterwards, your recipient of your document can set up the system the way where we having that document converted to their format, whichever it is, or we can push the API call to their systems.
Okay. In thinking about a health plan, and especially the non-structured or the non-HIPAA documents like an appeal, many of the health plans have like a PEGA or an OnBase or a business process management system that their people are used to using. So can you have a form people can type in the appeal, translate that into a format that would be ingested into a PEGA and OnBase? And how easy is that to feed those systems?
Well, we have some connectors already pre-built in the system. So some of the systems we can feed almost instantly. Well, that will require testing definitely, but still. But for the other systems, if they have APIs or database connection or whatever, we can use that to push the data into.
Yeah, but just a quick note. So in case we have a person or the company who are not, have enough resources or something to operate with the integrations, yet they can use the web interface and fill out the forms or the WebEDI platform. And after they send the data, we can connect with a particular file transfer protocols or API to the other company system, and we'll pretty much transform from internal DocStudio formats to needed company formats. Either it's going to be a JSON, UBL, X12, or any other format, particularly within built mapping tool. And that could work in the two possible ways. So pretty much back and forth. So if we need to receive like a response or acknowledgement or something like this, we'll be able to receive it we'll be able to transform it from the, let's say, Excel format to the internal DocStudio format. And the form on the WebEDI would be generated, and the data will be visible for the initial sender on the WebEDI as well.
Yeah, the fascinating case we had in the different industry, but still I think that is can be applied in healthcare, is that you all saw that we have kind of the signing order, right? So there are different recipients for each document. So one of your recipients were actually the AI models, and they do some learning on that data, or they store that somewhere, or they added something to the document based on the data that we already had in the system, right? So especially the last case we've done was that the AI model kind of looked into the database, found what this particular sender had sent before, and then linked those documents to that. So the next recipient afterwards could see that that is not the one-off. It's a story. Yeah.
Yeah, and maybe just one more thing. Oh, sorry, you had a question?
Yes.
Yeah, no, sorry, go ahead.
I wasn't clear from your presentation, what are your FHIR conversion capabilities? Are you converting different file formats to FHIR? And if so, what are the formats that you're converting from?
Mm-hmm.
Well, basically, it's anything which is structured. So what we've done already is we converted different XML formats, right? So as was mentioned before, PyDex, for example, in the oil and gas, right? And that is XML-based format. So different XML syntaxes into our internal XML and then to the FHIR, or vice versa. On the other hand, we've converted the DBF, database lines, JSON, APIs calls. I mean, everything which is structured and we can extract the value of the fields, right, and then put it into the XML. It is workable, doable, I say.
Yeah, so just one more thing. So pretty much FAR, it's a data set. Some of them are mandatory, some of them are optional. As we mentioned within the platform, we operated within the templates. So in this case, we might have some of the fields mandatory, some of the fields optional. So we pretty much will be able to transfer and showcase the data on the web API or either transform it or any other format. So let's say if some company implemented the API approach and use FHIR or like just JSON format, we'll be able to transform it to the company's format if they're using still XML or XML, or just require the web API to review, approve, or just simply store this data.
Anyone else? Nope. All right. Well, thank you guys so much. I really
Thank you
appreciate
once
that.
again.
It's a nice visual.
Thank you very much.